Hey everyone, in our last lecture over the respiratory system, we're going to look at some disorders associated with the respiratory system. The first is a series of diseases that fall under the category of chronic obstructive pulmonary disease, or COPD. There are different, so these are always some type of breathing problem associated with either inflammatory response to the bronchi or a breakdown of the alveoli. Most of the time, patients that have these diseases, severe forms of these diseases, I should say, have a history of smoking. In both cases, they're going to have labored breathing. They're going to cough, and they'll probably have more infections associated with the cough. They'll cough up phlegm and other materials a lot more often. People that have COPDs tend to be seriously hypoxic, and so they have way more carbon dioxide in their system, which leads them to respiratory acidosis and also causes oxygen to be the driving force for breathing. So the first one is chronic bronchitis. In this case, with chronic bronchitis, the bronchi are not open. So you see this one, you have a normal open airway where air can move into the lungs, and alveoli can then have gas exchange. With chronic bronchitis, we have an inflammation of the bronchi with excess mucus production. So people tend to be very cyanotic. They sometimes are the term blue bloaters, which I've never heard that term, but I don't work in the medical field. So if you have, then that's probably something that is common with patients that are cyanotic, because they will have blue fingers, blue tinged fingers, blue lips. They're going to have, they're going to typically have a lot of carbon dioxide retention, and so oxygen is going to be the driving force for breathing. The next is emphysema, and I know a little bit more about emphysema, as my dad actually has this disorder. So in emphysema, the alveolar walls are breaking down, and so this occurs as a result from smoking or from damage to those alveolar walls from other chemicals getting in. So this causes breathing difficulties because now we have less gas exchange room, so you can't exchange gases as effectively. Another problem from these patients is that the elasticity of their lungs decreases. So their lungs can't go back down to their normal shape. So normally you breathe, the lungs expand, and then they have to go back down to normal. In these individuals, people can't decrease the amount of the lung capacity, and so oftentimes they have this barrel chest, and they're pushing on their chest to try and decrease the size of the lung capacity so they can take another breath in. So not only is there less gas exchange because of the damage to the alveoli, but the lungs themselves no longer have that awesome elasticity. And again, there's a term called pink puffers. I've never heard of this, but it could be something that is in the medical field. Because of this disorder, oxygen again becomes the driving force for people with this disorder. When that happens, people have to be able to use, or they have to have low oxygen levels to keep them breathing. I always do this thing with my AMP class as an activity, and so I'm going to try it with you guys right now. So if you guys would do this along with me, I want you to take a deep breath in, and I want you to hold it for until I tell you not to. Okay, so I'll take a breath in. I want you to hold it, but instead of expelling it now, I want you to take another breath on top of that. And now I want you to hold that. And before you expel that breath, I want you to take another breath in on top of that one. So it'd be like, and that's what emphysema feels like, because you can't get rid of the air. Air is going in, but it's not being expelled. So it's a very scary situation, because when you can't get rid of the air, you can't take another breath in. What are some factors that influence COPD? One of the most common is tobacco, smoking. So that does not mean that if you do not smoke, you will not get COPD. What that means is that if you do smoke, you're more likely to get COPD. There are people that can smoke for until they're 99 years old and never have problems. There are other people who never smoke and they get problems. So it happens, but if you smoke, you're more likely. Another factor would be air pollution. So in both cases, they're going to lead to bronchial irritation, inflammation. They can also lead to the breakdown of the connective tissues of the lungs and destruction of the alveolar wall. In that case, now we're looking at emphysema. And this is serious, which causes airway obstruction. You're going to be more prone to infections, and you're not going to be able to breathe as effectively. Over here, when you have bronchial irritation, if it's chronic, then that would be chronic bronchitis, and that will also lead to airway obstruction, dyspnea, and infections, which overall lead to respiratory failure. So it's kind of crazy that my dad has this, which from what he says, he's a respiratory therapist by trade. He was grandfathered in, so he never had to take classes to become a respiratory therapist. He actually walked into the respiratory therapist. I'm sorry. He walked into the office of the respiratory therapy at the hospital that he was a janitor at and said, I want a new job. And the guy gave him a book and said, come in tomorrow and wear white. And that's how my dad got his job as a respiratory therapist. He's a basically trained on the job training therapist, and he worked for many years, saved many lives, and did some crazy things in that field. And of course, he smoked like I guess you don't say like a chainsaw, that'd be a weird, because chainsaws don't smoke. But he was a chain smoker. He would smoke a pack of cigarettes or more a day for a while. And this is back when you could smoke in the hospital, so he'd always have a cigarette in his mouth while taking care of stuff. And it's like, dude, you teach this, you know this affects your breathing. So then I don't understand why he would have done that, but you know, it's just an interesting story. But yeah, he's now suffering from this disorder. Another disorder associated with the respiratory system is lung cancer. Lung cancer is the leading cause of cancer death in both men and women. And most of these cases result from smoking. I know a little bit about lung cancer too, because my mom had lung cancer. I have a lot of respiratory problems in my life, don't I? My mom had lung cancer. She actually died from lung cancer. I believe hers was squamous cell carcinoma. But lung cancers, and I'll say that my mom was a smoker. So she also smoked. Actually, she smoked up until she died. Once she found out she had cancer and that treatment, that she only had 2 to 3 years to live, and that, you know, treatment wasn't going to do that much for her. She decided she was going to keep smoking, and actually, even though she did treatment, she died within 6 months. So they said 2 to 3 years, but the treatment actually caused more problems than it helped. And in my opinion, the treatment is what caused her to die at such, not at such a young age. She would have still been young, but so much more rapidly than the cancer would have killed her. But that is not me saying if you have cancer, don't get treatment. It just happened in this case with her. There we go. And the last disorder is asthma. Asthma is a disorder associated with typically hypersensitivities or allergies to certain materials. So these allergies can be to like pollen or dust, and what they do is they cause your immune system kind of goes out of whack and stimulates your smooth muscles to constrict in the alveoli or in the bronchioles and increases mucus production, and this leads to less oxygen or less air being able to flow. Asthma is something that you can grow out of if you have it as a young child, but if you don't, if you have it as an adult, then you're not going to outgrow it. But it is easily treatable. Most people can use a long-term treatment plan with certain inhalers that do not, they're not called rescue inhalers. They just help to keep the airways open all the time. You can use nebulizers, which will increase airflow on certain, or when you are having asthma problems, and then you always keep rescue inhalers with you just in case. There we go. So now let's look at some developmental aspects of the respiratory system. So respiratory system changes throughout life. The ability to breathe, or the number of breaths that are taken, will also change throughout life. So newborns have to take more breaths to get the same amount of air through their body because they have very small lungs. Infants then are going to lower the amount of breaths they have to take by the age of 5. So an infant would be, 1 year old, whatever. By the age of 5, respiration rates decrease to about 25 respirations per minute. By the time you are an adult, you're only taking about 12 to 18 respirations per minute. But then as we get older, the respiratory rate increases again. So it's like we go backwards. And so my dad, who has emphysema, he breathes really fast because he's trying to always get air into his lungs. So youth and middle age, the respiratory system problems are usually associated with infections or something blocking the respiratory path, okay? Whereas in old people, so as we get older, the lung elasticity decreases. So our cells don't produce the elastic fibers, which means our lungs aren't going to be as able to go back to their normal capacity. So this means vital capacity decreases and blood oxygen levels will decrease. This stimulates carbon dioxide, so this causes carbon dioxide levels to increase, which decreases their ability to stimulate breathing, which is where oxygen becomes a driving force. Elderly individuals often are going to be more hypoxic, and they're going to be more likely to have sleep apnea, where they have periods during their sleep where they stop breathing. So at this point, you should be able to tell me what hyperventilation is. What is hypoventilation? I don't know if I talked about that. I know that I have it written down. What is COPD? How does it affect breathing? What is chronic bronchitis? What is emphysema? What is the driving force for breathing in a person with emphysema, which I've mentioned a lot now? What is the most common cancer that leads to death? And when do lungs fully maturate in a fetus? And how long after birth does it take for the lungs to fully inflate? So I'm going to stop here. I'll upload this video and we'll be done with this chapter. Have a great day. Bye.